Okay, class, today's lesson will pertain to the synthesis of heme. Heme, the iron containing molecule of hemoglobin, is synthesized, which we call heme synthesis, in living cells by a complex yet fascinating pathway. Defects in this pathway result in a family of diseases known as porphyrias.
Porphyria. More like porphyria.
Now, let's walk through the 8 simple steps of this pathway.
I'm joking. Here at Derm Mnemonics, we think it should be more fun than that. So let us teach you 2 or even 3 things about heme over dinner in this sketch titled Pass the Heme, Por favor. Note that it will be important to know whether reactions occur in the mitochondria versus cytoplasm. So just remember that all of the porphyrias shown on the left edge of the table over to the right will occur in the cytosol, while erythropoietic porphyria is the only one we'll show to the left of the table and occurs in the mitochondria. You should also know that aminolevulinic acid synthetase is the rate-limiting enzyme, and that Porphyria cutanea tarda is the only subtype shown in this sketch that predominantly presents in adulthood. For the purpose of this sketch, we'll focus on the subtypes of porphyria with the most notable cutaneous findings, specifically Porphyria cutanea tarda, hepatoerythropoietic porphyria, congenital erythropoietic porphyria, and erythropoietic porphyria. They're, kind of a big deal. Speaking of a big deal, check out that table. I bet it smells of rich mahogany. And the cool guy sitting on the left is Captain Eurodotus, who will represent Porphyria cutanea tarda, or PCT. He's rocking a tight, Leonidas-like beard and a captain's hat to signify he's the captain of the family. The captain's hat will be our recurrent hook anytime we want to remind you of Porphyria cutanea tarda, or its features. Furthermore, can you see his cool captain's pin? This pin, made in the shape of a U with rods on the side, is to remind you that the defect in PCT is uroporphyrogen decarboxylase, or UROD. To reinforce this, we'll add the additional hook of his coffin behind him. Now this poor guy, he must be a little dyslexic. His title plate says PCT UROD instead of captain. Notably, PCT can be familial or acquired. This family portrait in the background should remind you that it can be inherited. The portrait may just look like some floating clothes, but that's because vampires don't show up on film. Duh. Ultimately, the acquired form is most common, but all forms are usually due to decreased or dysfunctional UROD enzyme activity. And PCT is the most common type of porphyria overall, which is why we've drawn Captain Eurodotus with a number 1 foam finger on his hand. Clinically, PCT is embodied by Eurodotus's appearance. The first thing you'll probably notice is Eurodotus's badass Leonidas beard. We want you to associate anyone with over-the-top body and facial hair in this sketch with hypertrichosis, and Eurodotus is no exception with his impressive face sweater and the gorilla arms. Next, you will see that Eurodotus's carbonated dinner beverage is bubbling over and covering the backs of his hands with bubbles and speckles of frothy blood. There's also a spilled salt shaker scattering white flecks of salt. These are to remind you of hemorrhagic vesicles and bulla in conjunction with milia, respectively. You should burn an image of this into your mind because it's classically used as Kodachrome for porphyria. Oh, and side note, Kodachrome by Paul Simon is one of my all-time favorite songs, so do yourself a favor and go listen to it. Alright, back to it. Additional signs include scarring, skin fragility, and hyperpigmentation, evident just by the shape of Eurodotus's beautiful olive skin and war-scarred body. Now, let's talk about the triggers for the acquired form of PCT, which we'll show behind Eurodotus by his coffin. Notably, a myriad of conditions which affect the liver can herald the onset of PCT. Now, to remind you of this, we've given Eurodotus a whopping serving of liver on his plate for dinner, as well as a liver-shaped pool of sweat on the ground. Specifically, this includes but is not limited to hepatitis, iron overload and hemochromatosis, HIV, elevated estrogen, and alcohol abuse. These hooks are represented by a recurrent hepatitis hippo here on the wall, the big iron dumbbells on the ground, the recurrent AIDS first aid bag, the wall art of a Greek fertility symbol by the weights for high estrogen, and the sangria alcohol bottle next to him, respectively. Now, for the boards, you should also know that the plasma of patients with PCT has peak fluorescence at 620 nanometers. I know, this is a bit ridiculous, but you're gonna need to know it. So, notice the cool glowing bottle of sangria next to Eurodotus. Well, it has a label which reads 620 AD. Oh, fun fact, sangria literally means bloodletting in Spanish and Portuguese. Now, I do want to apologize for breaking from the typical hooks, but this sketch is going to be very busy, and I trust that you derm mnemonic maniacs can remember all of it. This sangria bottle should serve to remind you of three things. Alcohol abuse can trigger PCT. If someone with PCT is exposed to 620 nanometers wavelength of light, that porphyrins in the blood fluoresce, and that phlebotomy or bloodletting is the primary treatment for PCT. The treatment of PCT revolves primarily around avoidance of the triggers, but there are a few other treatments that you can try. Phlebotomy is probably the most important, so just recall that sangria literally means bloodletting, but you can also try low-dose hydroxychloroquine or deferricirox. We'll show these with this intricate fountain of a siren for deferricirox holding what appears to be our recurring hydroxychloroquine hydrant. Now, you may be wondering why we chose a basement. First of all, it's because all forms of porphyria are photoexacerbated, and you should remember that photoprotection is the most important aspect in managing their skin. But we also chose a basement with a doorway going upstairs to make you think of a basement membrane. Test writers like to go after porphyria by showing you histology slides, so we thought this might be a good way to cover the key features. First, you'll notice some tattered drapes that appear to be festooning attached to the basement ceiling. This is to remind you of the festooning dermal papilla seen in the histology of prototypic porphyria. And what are those gross glowing worms crawling all over them? Well, if you said caterpillars, then you have a good eye. These glowing caterpillars signify the classic finding of caterpillar bodies, which are simply remnants of the basement membrane and degrading keratinocytes, and the slime trail that they're leaving behind and the slime on these pipes on the wall is to remind you of the linear deposition of C3, IgG, IgM, and fibrinogen along the basement membrane zone and around the dermal blood vessels. Lastly, PCT is another condition seen on the cell-pore differential, so we've included these people-pore line of empty chairs by the doorway. I know that seems like a lot, but you need to know the most about PCT, and the next characters in the sketch should be easier. Meet Sir Hepatoerythropo, or Sir HEP, who will represent hepatoerythropoietic porphyria, or HEP for short. He is small and somewhat childish, in order to remind you that this form occurs in childhood, and we've placed him next to Urodotus wearing a urod pin. He's like a little, ugly Urodotus. He's positioned here and wearing the same urod captain's pin in order to remind you that HEP is also due to mutations in urod. But unlike PCT, it's homozygous mutations which accounts for the more severe clinical manifestations of HEP. Now I think this guy fancies himself a knight. After all, why else would he demand being called Sir HEP? And what would a knight be without a shield? Now, you may recall from our previous sketches that the shield is a recurring hook for sclerodermoid changes, which is a classic feature of HEP, and so we'll add a shield on the ground next to Sir HEP. Other clinical features of HEP closely resemble PCT, including milia, vesicles, bulla, erosions, ulcers, and hypertrichosis. So we've drawn him with an excessive amount of body hair and reaching over towards Urodotus for his overflowing glass of bubbly, with bubbles and salt getting all over his hands. Unlike PCT, the amount of photosensitivity associated with HEP is so severe that it can lead to full-on mutilation. And this is why we've drawn him to resemble Nosferatu from the old-school vampire movies. Our next porphyria will be represented by this very European-looking vampire at the right end of the table. We'll call him Gunther, the red-toothed Eurogunner, and he represents Gunther's disease, also known as congenital erythropoietic porphyria, or CEP for short. Much like Urodotus, Gunther's name holds a lot of meaning. First, Gunther should remind you that this is Gunther's disease, while the red-toothed Eurogunner is to remind you that erythrodontia, or red teeth, is a classic Kodachrome, and he's European because the mutation that causes CEP is uroporphyrinogen synthetase 3, or UROS3, which I like to just pronounce as UROS3. To reinforce this, let's draw a pile of euros on the table next to him, with our recurring 3 heart tattooed on his arm. You can also see that Gunther's sangria is giving off a strange glow, much like his family members. This is to indicate that porphyrins are also visible in the RBCs and plasma. Another classic feature of CEP is a red staining in the urine, beginning in infancy, and to remind you of this clinical pearl, we've drawn him wearing some very European shorts with red staining. While not explicitly shown, It may show up on the boards that the porphyrins causing the red urine are apparent even at visible light within the Sorite band of 400 to 410 nanometers wavelength light. As you see, Gunther won't be winning a beauty pageant anytime soon, but I guess he could give Sir HEP a run for his money. You'll notice that he's wearing cool red sunglasses over a scarred portion of his face. These hooks represent conjunctivitis and corneal scarring, and like HEP, CEP also has sclerodermatous changes and hypertrichosis, so we've added another scleroderma shield on his back and drawn him with a bushy beard. While he may have great facial hair, his head looks a little patchy, doesn't it? This is a subtle reminder that patients with CEP get a patchy, scarring alopecia. Additionally, they're prone to terrible mutilation and contractures due to severe scarring, so we've drawn him with a large claw-like contracted fingers and scars all over his arms. This is definitely the type of guy that drives around in a panel van with puppies and candy in the back. Super creepy. Not to mention, why does he have a pile of broken bones and vertebrae on the ground next to him? Well, that's because these patients are prone to pathologic fractures, such as compression fractures. The last and probably most testable cutaneous feature is shown by his teeth, which are red with blood. Wine. This is a reminder of erythrodontia, which is best seen under Wood's lamp, and Kodachrome's commonly shows up on tests. Unfortunately, those with CEP also have significant systemic issues, including hematologic and gastrointestinal issues. To represent these, notice the overflowing red blood cell-shaped bowl of blood soup with a crack down the side oozing blood in front of Gunther. This will represent hemolytic anemia, and next to the leaking soup is a big piece of spleen to represent splenomegaly. A complication of hemolysis is cholelithiasis, so notice the gallbladder-shaped geode which is sticking up out of the floor. We'll use this hook anytime we want you to think of cholelithiasis. Patients with severe hematologic disease have a particularly poor prognosis, but there are treatment options for these patients which will show scattered around Gunther. If there is significant hemolysis and splenomegaly, splenectomy is beneficial. But in other patients, treatment options include rapid transfusions for severe anemia, vitamin C or ascorbic acid, vitamin E or alpha tocopherol, or chelation with deferoxamine. We'll remind you of these treatment options with the knife sticking out of the spleen for splenectomy, Gunther receiving a transfusion, drinking the blood just isn't good enough for him, a delicious kiwi for vitamin C, and this furry ox rug for deferoxamine. Note that the edge of the ox skin looks like the letter E for vitamin E. Oh, by the way, fun fact. Even though everyone thinks of oranges as having high vitamin C, kiwis are actually a much better source. Our next and final character is Amenhotep, the Pharaoh killer. Amenhotep, spelled with an EPP at the end, is the character that we will use to represent erythropoietic protoporphyria. And as you can see, he must be from Egypt. The EPP at the end of his name is to remind you that he represents EPP, and the fact that he looks like a pharaoh and his nickname, the Pharaoh Killer, is to remind you that EPP is secondary to defects in the enzyme ferrochelatase. This is the most common type of porphyria seen in children, typically manifesting between 1 to 6 years of age. So you'll see that we've drawn him as a child and have him wearing a number 1 foam finger to remind you of this. On tests, the question stem might mention delayed pain 3 to 30 minutes after light exposure, which is unique to this form. We'll try to help you remember this by showing him wincing in pain and wearing a bling watch, which looks like a sundial. Now this is because the guy's old school, and it's to remind you of sun or UV exposure. Now on his hands, you can see some bling bling. This is to represent the papules that develop on the knuckles of persons affected by EPP. Now try to tell me that that is not a badass sarcophagus. The scratch marks across his face are to remind you of shallow, linear pits that can develop on the face. But what's sticking out of the scratches? Fingernails! The nails are a small hook for photoonycholysis, which can occur in this type of porphyria. Now, let's look at what Amenhotep is having for supper. Apart from similar names, EPP, just like CEP, has increased risk for hemolytic anemia. So, we'll give Amenhotep a big bowl of blood soup in a cracked red blood cell bowl on his dinner tray. However, a unique feature seen in these patients is hypertriglyceridemia. So, we'll also put a stick of butter next to his soup to represent hypertriglyceridemia. Again, if the patients have hemolytic anemia, they have risk for cholelithiasis. So, we'll include another decorative gallbladder-shaped geode next to Amenhotep. The treatment for EPP is pretty unique. and you should remember that they may benefit from beta-carotene, and some patients may need a liver transplant. This will be shown by a big helping of carrots to help balance out the butter, and what's a pharaoh without at least one canopic jar? In this case, the jar specifically shows the Egyptian god Mseti, which in Egyptian mythology was the son of Horus and is said to protect the liver. The more you know. You'll also see on the jar the outline of a liver, which of course signifies his jar containing a liver. Hopefully, this is a strong enough hook to remind you of a liver transplant. Now I know what you're thinking. We didn't even mention which forms have porphyrins in the stool or urine. But this isn't high yield, and honestly, this sketch is packed already, guys. Well, I'm sure after meeting all these gnarly vamps, you may have lost your appetite. But before you go, let's wrap up and review the hooks. Porphyria cutanea tarda is shown by Captain Herodotus on the left side of the table facing us. This is the most common type of porphyria overall, recall the number 1 foam finger. And the acquired form is more common than the familial. He's wearing a captain's hat, which we'll use anytime we want you to think of PCT. He also has his U-rod captain's pin to remind you that this is due to defects or mutations in uroporphyrogen decarboxylase, or U-rod for short. We've also included his coffin with PCT U-rod in the back for additional reinforcement. The clinical features are shown with the character himself and include hypertrichosis, hyperpigmentation, hemorrhagic bulla, milia, and scarring. Recall his hairy body and manly beard, the bubbles and salt grains on his hands, and his hyperpigmented olive skin riddled with scars. The associations that can induce or worsen PCT are shown behind him and include iron overload and hemochromatosis, liver disease, high estrogen states, HIV, hepatitis, and alcohol. This is shown by the liver-shaped pool of sweat, iron dumbbells, Greek fertility symbol, AIDS aid bag, hepatitis hippo, and bottle of sangria. The sangria bottle serves several functions. First, it's from 620 AD to remind you that the porphyrins in patients' plasma fluoresce at 620 nanometers. But the sangria should also remind you that alcohol is a trigger, and treatment of PCT revolves around phlebotomy, or bloodletting, which is the literal translation of sangria from Spanish to English. Aside from phlebotomy, PCT management revolves largely around photoprotection, which is key for all porphyrias. But you can also use low-dose hydroxychloroquine or defacerox. Remember these by remembering they're in a basement to protect them from the sun, and the fountain of a siren and hydrant for defacerox and hydroxychloroquine. The histologic features are shown with the scenery. Recall that this is on a cell-pore subepidermal blister differential, hence the people-pore row of seats, and has the classic findings of festooning dermal papilla with caterpillar bodies, the festooning drapes and glowing caterpillars. On DIF, you'll see linear IgG, IgM, and C3 deposition at the DEJ and around the vessels. This is shown by the linear goo trails along the drapes and glowing goo dripping from the pipes on the wall. The next character is Sir HEP, who represents hepatoerythropoietic porphyria. Recall that he's a child and his Nosferatu-like appearance is meant to remind you of the severe scarring and mutilation that occurs in this subtype. He's positioned on the same side of the table as Herodotus because HEP is also due to mutations in urod. But in this case, it's homozygous mutations. The clinical manifestations are almost the same as PCT, so the character is portrayed as being very hairy and having the same bulla bubbles and milia salt granules on his hands. The shield on the ground behind him is our recurring hook for scleroderma-like changes, and this is a feature seen in HEP that is not seen in PCT. Gunther, the red-toothed urogunner, represents Gunther's disease, also known as congenital erythropoietic porphyria, and is positioned on the right. This is due to mutations in UROS3 or UROS3, which we've shown with a pile of euros on the table in front of him and a 3-heart tattoo on his arm. This form results in severe mutilation and scarring with contractures of the digits, which is shown by the scars all over his arms and long contracted claw-like fingers. Scarring of the scalp leads to patchy alopecia, shown by his patchy bald head. One of the first manifestations is red urine and begins early in childhood. So recall his very European short shorts, which are almost diaper-like, and stained red. Gunther also represents the systemic manifestations including hemolytic anemia, cholelithiasis, splenomegaly, and pathologic fractures. So remember the cracked red cell bull oozing blood soup, cholelithiasis geode, large spleen on his plate, and a pile of broken bones and vertebrae all around him. Hematologic disease portends a poor prognosis, but there are some treatments that can help. namely splenectomy, transfusions, ascorbic acid, alpha-tocopherol, and deferoxamine chelation. And these are shown around our character as a knife in the spleen, bag of blood he's receiving as a transfusion, vitamin C kiwi, and the deferoxamine furiox with an E shaped into it. A bonus factoid that may show up on boards is that the urine is excitable by visible light in the SORET band from 400 to 410 nanometers wavelength. Last but not least is Amenhotep the Pharaoh killer, who represents erythropoietic protoporphyria. This is the most common type seen in childhood and is caused by mutations in ferrochelatase. Recall the mutation by recalling his pharaoh outfit and his nickname, the Pharaoh Killer. And we've given this small kid a number 1 foam finger and placed him in a high chair to remind you that he's the number 1 cause in children. Clinically, it presents with delayed pain to UV exposure, papular nodules on the dorsal hands, linear pits on the face, and photoonycholysis. This is shown by him wincing in pain with a cool Egyptian sundial watch for delayed pain to UV exposure, his sweet bling rings to remind you of papular nodules on the dorsal hands, and his sarcophagus with linear scratch marks across the face with nails still sticking out for linear pits and photoonycholysis. Like CEP, EEP also has risk for hemolytic anemia with subsequent cholelithiasis, so he's also got a cracked red blood cell bull oozing blood soup and a decorative cholelithiasis geode. However, these patients are also at risk for hypertriglyceridemia, so there's also a plate with butter on it in front of him. Again, these patients may benefit from blood transfusions for anemia, but the 2 most testable treatments are beta-carotene and liver transplant, which are shown by the plate of beta-carotene carrots to balance out the butter, and the canopic jar with a liver on it to remind you of a liver transplant. Alright, I know that video was long, but I'm proud that you made it through it. So, take a break. I'll see you next time.